Hello everyone. First of all, a big thank you to the participants of the study and also to the members on the member coaching program site. I wanted to give you a brief review of my findings from the study so that you don't have to read the study itself, or that if you do want to read it, please feel free to contact me and I will get back to you. The title of the study was Beyond Thyroid Stimulating Hormone Back to Thyroid Basics. I spent 2017 studying a postgrad diploma in endocrinology, and then last year spending most of the year studying a master's research dissertation and doing my own research. The purpose of this study was to evaluate the accuracy of thyroid stimulating hormone across all areas of thyroid function, because it is considered the gold standard for thyroid assessment. The objectives were really to assess the relationships between body temperature, pulse rate, hypothyroid symptoms, and the findings of blood tests associated with those values. Also, the objectives from the study were to kind of assess and review the factors that might cause thyroid stimulating hormone values to be inaccurate, combined with aspects of nutrition and body temperature and pulse rate. And we had some very interesting findings. First of all, I'm just going to talk to you about what TSH is. As I said, it's the pituitary hormone. First of all, when supposedly low levels of T4 or T3, the precursor hormone and the active hormone and thyroid hormones are low, we should see that be reflected in the hypothalamus. The hypothalamus, when it gets this signal, will release something called thyroid releasing hormone to stimulate the pituitary to release thyroid stimulating hormone. And that should stimulate the thyroid gland to produce more T4 to convert more T3. And usually more of this tends to happen less at the gland but more peripherally at the liver, the kidneys, and even skeletal muscle tissue. So in primary hypothyroidism, where the gland is not working as well as it could be, we might see an elevation of this TSH and low levels of the other hormones, T4 and T3. In secondary hypothyroidism, perhaps related to pituitary and other issues and stressors, we might see the thyroid gland working well, but then TSH is low and we see equally low values of T4 and T3. You can also see the values associated with subclinical and resistance to thyroid hormone, and we'll discuss these shortly. The problem that we have with TSH is under a wide variety of influences. Circadian influence of TSH shows us that thyroid stimulating hormone is generally higher at night time, and this might be due to the effects of melatonin, which decrease thyroid hormone, make the body colder and send us off to sleep. We can see these thyroid stimulating hormone values also change throughout the year and with temperature. So for example, in warmer ambient temperatures, we generally have less need for thyroid available. And therefore, as it gets colder, we see more thyroid hormone needed to maintain our body temperature at 37 degrees, which is the suggested norm for most mammals. Unfortunately, I contend that the reliability to assess thyroid function from TSH is reduced. It's a reduced proposition because there are so many factors that affect TSH values. The deiodinase enzymes are one, and we have D1, D2, and D3. D1 and D3 are expressed in the body, or throughout the body, and D2 is expressed primarily in the pituitary. And unfortunately, this is where some of the accuracy of thyroid hormone levels, particularly TSH, can become problematic. In the pituitary, it should be saturated with T3. The available active thyroid hormone levels should be around. And when the body can't receive that, and it's just looking at the brain is understanding that the pituitary levels of D2 and thyroid hormone, it might just perceive these as normal and not accurately reflect the systemic levels and the peripheral conversion of thyroid hormone throughout the body. Aging tends to increase thyroid stimulating hormone, and there are a number of factors related to the factors that we're going to talk about that can have a factor with that. When we get sick, we're stressed, we've had surgery, this all represents with low thyroid stimulating hormone, and more often than not, we should see low T3 values, but these aren't always picked up. As our mitochondria, our energy producing cells, become damaged, we tend to see that thyroid issues start to occur, particularly damage to thyroid hormone receptors, which we'll also see in pollution, and sometimes thyroid hormone resistance, which should actually present with increased T4 and T3, but again there are nuances to this. We know that fasting, because it increases the stress hormones cortisol and also glucagon, to liberate energy from stored fats because there's low blood glucose available and low glucose available in the liver. It will produce these stress hormones. And this has an effect of reducing the thyroid hormone receptors, which are everywhere, including the pituitary and the hypothalamus. So if the receptors are low, we'll tend to see that thyroid hormone is also low, which will present as a normal thyroid value. We have subclinical hypothyroidism as well. And bearing in mind that with this, we tend to see normal TSH values and generally normal T4 and T3, but perhaps TSH is slightly elevated. It's contentious because some studies have shown that when people have been treated with synthetic thyroid hormones, this hasn't had any results at all. But if you put into the effect of nutrition, environment, stress, then these might just come back as normal anyway, and expecting thyroid hormone to change by just addressing it with synthetic T4 is problematic in itself. There are other studies that showed T4 and T3 have been useful for creating change beyond just synthetic T4, and we also have natural desiccated thyroid, where some studies have shown that it's created more weight loss and generally have felt happier and better taking natural desiccated thyroid. And in the particular study that's well known, about 50% of people preferred taking that. So we have some issues that are comparable with the treatment and evaluation of TSH values compared to treating subclinical hypothyroidism. Environment is a huge player as well. Pollution that we find in the air, in our food, in plastics, in water, has a net effect of decreasing thyroid hormone values, and particularly TSH values. Both the TSH receptor and the thyroid hormone receptor that are found throughout the body generally get hijacked by these environmental pollutants. And in the same action, environmental estrogens also upregulate the effects of estrogen, which decrease the values of TSH and thyroid and other thyroid hormone values. More recently, wireless has also found the same effect as well. So phone technology, Wi-Fi technology, all of this stuff seems to reduce the effect of thyroid stimulating hormone feedback and output. What you can see here is that thyroid hormone, when you are hypothyroid, the symptoms tend to flag up pretty quickly, whether it's digestion, mood, metabolism, heart-related factors like blood pressure or cholesterol, movement, skin, hair, so many factors, and even fertility are affected by thyroid hormone values. And these symptoms do tend to occur long before the actual blood and the biochemistry starts to show any changes at all. So perhaps there's too much emphasis on numbers and looking at these values, and maybe the use of temperature and pulse rate can actually provide an insight into whether someone's metabolism and ultimately thyroid physiology is failing. Here's some of the findings from the study, and what we found is strong linear and negative correlations between the temperature, the thyroid stimulating hormone values, and multiple thyroid symptoms. In this graph here, that you can see that we tested mouth and armpit temperatures in a fasted state and then 60 minutes past breakfast. And with the exception of one participant, subject 5, who was taking hormone replacement therapy and was the only person to have exercised in a fasted state, showed that not only was her temperature the only one to reach over 37 degrees, that there was a stark contrast to her trunk temperature, which was some 3 degrees lower. So as endotherms, humans should regulate their temperature at 37 degrees. On waking, it should be around about 36.5 and increase to 37 degrees after a good feed. Here we can see that nobody presented with anywhere near the 36.5 in the mouth, and certainly in the armpit the values were much lower. So when we look at the concept of a central compartment theory, where the brain and the core should have the same temperature values, this is decreased significantly. Ultimately, what you should see is with the brain as well, is it should be the last place to go cold. So it uses 75% of the blood's glucose values. But what we might start to see is perhaps temperatures in the trunk and core go down first. And that's where we see perhaps analogous kind of symptoms like decreased metabolism, slowed heart rates, inflexible arteries we see, because thyroid hormone is a very potent factor on regulating arterial stiffness. And also what we'll tend to see is constipation, low energy states, not being able to have enough energy going through the bowel, for example, and multiple other symptoms. So What we did find from the study, and one of the main discussion points, is that individuals tested showed strong relationships between decreased temperature, mouth, armpits, multiple symptoms, around about 7, but yet presented with these normal thyroid blood tests. So in a nutshell, what happens is people will go and they have high blood pressure or high cholesterol, and they get given these medications, and they've had their thyroid tested. Because it tests normal, they're put in these perhaps unnecessary medications to address thyroid function. As I said, subject 5 also showed interesting data because she was taking hormone replacement therapy, which will throw out the values of thyroid values because it can decrease thyroid stimulating hormone and thyroid hormone assessment as well. All of the heart rates that we looked at were pretty much potentially in a low thyroid state at some point. So generally heart rates of 50, 60 and 70 beats a minute are suggestive of bradycardia or low heart rate, probably having some synergies with this low thyroid state. Some other aspects that we need to consider are the limitations of the study. It was a very small study, only 5 participants. We also had issues perhaps because they were instructed on how to take temperature and pulse rate and how to record their nutrition, but the instruments were not calibrated. They were given video communication as well about how to do this, but because it wasn't done in a clinical setting, the reliability and calibration of equipment needs to be considered. We also need to consider the fact that they went off for other blood tests at different labs, but at the same time, the doctor who referred to the lab for the analysis should be confident that those tests were accurate and calibrated. As I said, the small sample size is something that needs to be considered as well and lacks the ability to be generalizable or transferable. So we need to be aware of this small size of the study. However, we did show some relationships that show clinically that people were biochemically normal thyroid, but clinically had many thyroid symptoms, and they had altered metabolism with low temperature and low pulse rates. So perhaps if we are looking at why this is clinically relevant, is that if people are going to the doctors and being prescribed different medications for all these symptoms, when thyroid affects vast areas of physiology, we might be able to get to a root cause of many people's issues rather than prescribing medications with many side effects. So in summary, the hypothesis that I tested was found to be true. There are many other things that we could look at and that I will be looking at exploring. But just again, thank you for everybody's assistance with producing this study and your support over the last couple of years. And I look forward to producing more work, more lessons and more information for people over the next year or so to help this site get better and to help more people. So thank you once again.